I'm Debbie McCune Davis. I'm the Executive Director of the Arizona Partnership for Immunization. And I'm glad you're with us today while I talk to you about the importance of keeping our workplaces safe. No matter what role we play within an organization, we all have important missions to do, and we cannot complete those missions effectively if we are ill and if we can't rely on the teams that we've built to meet those goals. So with that, I want you to walk with me through the process as we talk about some of the strategies that can be used to vaccinate our population and keep our workplaces healthy. Next slide. If you're following the media, you know there's a lot of discussion about mandates and requirements and all that's coming, mostly from the federal government, and specifically the workplace safety issues that were tentatively issued by OSHA, the federal safety agency. Those rules are on hold right now because the court is reviewing them to see if there was in fact legal authority to do them. So even though they are out there and may come into being at some point in the near future, I want to talk about why we want to do that with or without the requirements. Next slide. So my project, the Arizona Partnership for Immunization, has 19 employees. We've been working remotely for most of the pandemic with a few folks who come in and out of the workplace, but we have instituted policies to make sure that that workplace is safe for whoever's there. And we do that because we have important work to do. The pandemic certainly amplifies that. But we want a safe workplace. We don't want our employees being sick and taking the virus home to their families. We know that families of children oftentimes miss work if their children are sick and can't go to school, or if they're excluded from school as a result of a COVID exposure. We know that going forward, the insurance costs related to hospitalization and healthcare services will ultimately impact our costs. And we are seeing significant post-COVID side effects that do affect employees and oftentimes slow the ability to return to work, or in at least a few cases I know of, basically leave them with a disability that makes it impossible to return to work. We have too much invested in our workforce to take that casually. Next slide. So there's a national organization called the Health Action Alliance that is keeping the employer community up to date on what the current policies are and what is needed. And I wanted to introduce them to you today so that you can sign up for their webinars and get current information. What I'm sharing with you today is current today. And we know that these circumstances are going to change. And I want to make sure that you can make use of their resources as they allow us as employers to make good choices. Next slide. So we're going to look at two interesting bits of statistics. You know, our project, the Arizona Partnership for Immunization, has a goal of keeping people safe by having a well-vaccinated population. And so we look at national numbers, and we know that we're making good strides to vaccinate the population. The older our population is, the more likely they are to have been vaccinated against COVID. And we know that there's new policy approvals that just occurred in the last few weeks that allow our younger children to get vaccinated. So we've been looking at the attitude of parents as to whether or not they will vaccinate their children. And some of that's been translated into vaccine hesitancy. So why are people, and specifically in this case, parents, hesitant to vaccinate their children? And the information that comes back is insightful and helpful. For instance, as of October, 46% of children 12 to 17 received at least one dose of vaccine. That's a very good start. We're off to the races there. We know that there's a new expansion to bring that age down to age 5. But we know that only 27% of parents are eager to get them vaccinated. So that means we have to have conversations with parents to explain to them that their concerns, though valid, aren't going to protect their children against the COVID virus. So looking at the far right hand of the screen, you can see that what the surveys are showing are that 76% of parents think there's not enough known about the long-term side effects of the vaccine in children. So they hesitate. 66 are concerned for the vaccine may affect their future fertility. And 53% are worried that the child might be required to get the vaccine without their approval. In Arizona, parent approval is required. And the evidence is that there's no impact on long-term fertility, but we have to present that information from good sources to assure families that they're making the right decision. We also know, and this is a really interesting statistic, that low-income parents have been concerned about vaccine access, and they are not getting vaccinated because they're afraid of side effects from the vaccine that will keep them from reporting for work. And they don't want to put their jobs at risk. So if you have policies in your workplace that don't facilitate getting your family, giving them time to get vaccinated, you may want to take a look at that to make it easier. So they're concerned about the vaccine sites, about accessibility. And if we go to the next slide, we can see that they are concerned not only about taking time off to get their kids vaccinated, but things related to the vaccine site, potential cost, and frankly, lack of access to a primary care provider. So these are just some things that showed up in a recent survey that we can address to make it easier to get these families and these workers vaccinated. Next slide. So we are concerned. I think yesterday we saw an event in the media with hospitals saying that they are seeing an increasing number of people hospitalized from COVID. And we know that with our kids, it's not been as bad as adults, but as they remain unvaccinated, they remain vulnerable. And we do know that the rates of hospitalization are increasing, and we don't want that to continue. Next slide. So my purpose today is to really help you find the resources you need to provide the best services you can to your employees and the people you serve. Next slide. So in Arizona, we have an immunization portal, and there is a portable means to retain and maintain your own immunization record. It's called MyIR Immunization Record Portal. And the information on this slide shows you how to put in your information and have a portable copy of your own immunization record. And you can put in not only your own, but those for your family. And this will help in the event that someone needs to show that they're vaccinated in the future. So MyIR is a tool that is being refined with every step forward that we take, but it's a valuable tool. And I've talked to a number of people who've successfully retrieved their vaccine records, including their COVID vaccines. And this has helped them be able to go to concerts to show their employer that they're vaccinated, but it's something that you can use and share with your employers. And at the bottom, well, there is a link, and we can come back to that if we need to. Next slide. So if you've lost a vaccine record, the question is, and I've talked to people who've lost their records and who have had incomplete records where the staff that gave the vaccine didn't fill the form out completely. And this is a mechanism where you can request the information. There is a form on the ADHS website that you fill out, and they will return the information to you. Another important tool. Next slide. And within our organization, in partnership with our county health departments, we have recruited an educational team that has been out in the community answering people's questions and helping them get comfortable with the COVID vaccine. Next slide. So far, just in the last few months, we've been able to do 68 total events, and that those events are planned specifically for the group that's requesting it, including a diversity of populations and languages and cultures. And it's been really interesting to see how that process has helped people feel more comfortable with protecting themselves against the COVID virus. Next slide. And here are some examples. And some of them you will see are organizations, some of them that we've been to churches, we've been to employers, we've been to schools, met with parent groups, we've been in rehab centers, and the group that go out or provide a virtual online presentation are retired nurses and doctors or folks who worked in public health, know and understand the importance of a well-vaccinated population and do answer the specific questions in the context of the event itself. Next slide. So we've been in cultural centers, we've been in adult senior centers, and our presenters, as I said, have been working in this field for a long time. So they have great confidence in the information they're sharing. And that one-on-one information has helped people move forward to get the vaccine who might otherwise have felt they didn't have enough information. And we have found this to produce some pretty good results. Next slide. So we actually sent a volunteer who went to a work site and who spent time during the lunch hour with staff at that work site and answered their questions. When the event occurred, their site was about 55% vaccinated. And they were pleased because they know that the more employees that are vaccinated, the less likely the virus is to spread among their employees. But after the volunteer was there and spent time and accommodated the families to get the vaccines, that company's vaccination rate increased by 20%. And that's a significant difference. And I've worked in public health a long time. We know that just like in so many other things like technology, we have early adopters, people who do look into things and are ready to move forward. And then as you go up through the percentages, people need more information and more support to move to a decision. Next slide. So how do you request an educator? There's a form that's on the SurveyMonkey link that's here. And the speaker can come with a prepared presentation that walks through the basics of how vaccines work and then answer the questions of the folks in the community. We've done it in English and Spanish and multiple other languages. And we adapt both the presenter and the presentation to the request. And I encourage you to take advantage of this resource. Next slide. And then we built a TAPI vaccine finder. And this is not so different than the vaccine finder that the Arizona Department of Health Services has, or that you can find on county websites. The difference is that it can be translated into over 100 languages, and that it's built to be used on a mobile device. So if you are in a setting that's informal, you can use an iPad or you can use a phone, and you can assist people in finding a location that has the vaccine that you're looking for, when those vaccines are available. And we also tell you whether there's a Spanish-speaking staff on hand, but things that help people take that next step and move forward. Next slide. So here's more information about the vaccine finder. In addition to the standard locations that we know about, the pharmacies and clinics, there are a lot of pop-up clinics going on in the community. And we add those pop-up clinics when we are aware of them. And this has been a real benefit too, because some of these clinics are at school settings and some are at community events. And so these are places where people may be comfortable and have a chance to talk to people and to get their vaccine. We've included a resource page with answers to a lot of the questions, and those can be translated. And as I said, it's portable. We will be adding within the next short period of time, I'd say the next 30 days, an option to research all the sites by vaccine type and to help with locating vaccine testing sites, which are being added. We're doing an overlay that allows testing information to be added. So, and we're also working with the ArcGIS folks who basically own this technology to add an overlay with tribal boundaries to serve the populations who want to be served within their own communities. Next slide. These are the links. One is to the webpage that has all the resources on it, and the other is directly to the map. And again, I encourage you to take a look here. And if you have folks who are simply delaying getting the vaccine because it's not convenient, this may be a really good tool to help them find the place, find out if they'll take walk-ins or do what needs to be done to schedule an appointment. But in any case, you can be part of the group that helps us move forward to protect the population, keep them healthy and out of the hospital. Next slide. And these graphics are available for you as well if you have social media accounts and you want to make them available to your employees. These tools were built by our team, our staff, and we have lots of those kinds of resources for you. Next slide. And in fact, we have follow-up appointment cards. If you work with a group and you actually move them to the point of scheduling appointments, these are the cards that help them remember where to go and when to go. The QR code takes them to all the information they need to know about the vaccines and helps them make sure that they follow through to take the next step. Next slide. If you have an interest to have someone in your organization trained on using the vaccine finder, our team is ready to do that. We also have some iPads that are available to be checked out. So if you know that you are going to have meetings with staff and you want to have some additional tools, or you're working with a population and you have somebody who can go hand in hand with an educator, we have those resources to allow you to work with them. They're preloaded and already have the links, the internet links. And so it's a simple process. Next slide. And this is another feature that's available through two different resources that I'm aware of. And I know that some of the other counties have this as well. If you would like to actually host a clinic for your employees or your employees and their families or the population you serve, you can request that a clinic be scheduled at your work site or at a site that is easily accessible. And on the left is the form that would allow you to request vaccination, mobile vaccination vans, basically, to come to your site through the state of Arizona, and on the right through Maricopa County. And I know that, like I said, I know other counties are doing this as well. I know Pima County is, and I know some of the other counties are as well. So next slide. So these are really challenging times. We've all been through now 20 months of living in an altered environment where when we leave our homes, we know that we are at risk of catching a virus. Those who are vaccinated have reduced that risk, but not completely. Those who are partially vaccinated have taken the important steps to get there, but we need people to be completely vaccinated with a complete series, including boosters. And so these are the things that, if information is available in the workplace, in our nonprofit community, in our project work, we can help people take those steps and reduce the risk. And I want to remind you, we now have 5 to 95 or 100 ages of people who can get vaccinated. But we're not there yet with those little bitty ones, with our very smallest, youngest children. And so we have to protect them by surrounding them with healthy communities. So thinking about people who go into workplaces who aren't safe or aren't protected, the risk of taking the virus home to their family still remains in place. And the quote that's in front of you is directly from the American Medical Association. And they not only support the idea of getting vaccinated, but they support it as a requirement that workers who are at companies of 100 workers or larger be vaccinated or tested regularly, and that in an interest of vanquishing the virus, so we don't have to encounter it on a daily basis, this is the way that we step up and show them that we're serious and make that virus go away. So I believe that's my next to last slide with my contact information here on the end. And we are working every day to make tasks easier for you, to do things that keep your population, your employers, your employees, your people who you serve and care for healthy. And I encourage you to contact us if you have questions or if there are things that we can do to make this task easier for you. Thank you so much for joining us today. And rest assured, we are working in partnership with all the medical professionals in the state and the state and county health departments and our providers to make sure that vaccines are easily accessible. We know they're safe. We know they're effective. They are our best strategy for saying goodbye to COVID-19. Thank you again.